Please tell us what's the role of utriculus in rotatory head movements, please?
So the utricle, of course, detects linear acceleration, but in fact, we can actually use that information when we rotate our head because the utricles are here, and if we move our head, we get a tangential force, and we also get a centrifugal force. So actually the utricles can help us when we are not getting the proper signals from the canals. Furthermore, you can actually rotate your head off the vertical axis and you continue to get a nystagmus because the utricle signals are telling us that we have a rotating gravity vector. Now, why is all this physiology important? Because people complain of symptoms when they tilt their head, and when they're not rotating, they may feel they're rotating. So if we actually understand this physiology, we'll be able to translate it into very practical aspects of diagnosis and treatment.
What would you expect in a patient with isolated utricular lesion?
So they will have trouble telling which way is up. In fact, we can do a test. If you rotate someone on a chair and move them so the axis of rotation is around one ear, only the other ear is stimulated, and by measuring the tilt or the way the eyes counter-roll, you can actually measure the function of a single utricle. And this may actually play a role in BPPV and the symptoms those patients have. The utricle's not working right, it's missing some of its stones, and people feel imbalance. So it's not always stones, it's also the problem with the utricle.
And what about nystagmus in patients with utricular lesion? Should we expect one horizontal, torsional, downbeat?
Yeah, so this is a difficult question. What kind of nystagmus do we get if we stimulate the utricle? Clearly we can get translation and horizontal nystagmus, but you can do experiments and stimulate different parts of the utricle and get different patterns of nystagmus because the utricle changes when we pitch our head forward, when we tilt laterally, and when we move side to side. We're just beginning to understand all these problems with the utricle. The canals are simple. Probably no one agrees with me, but the utricle is a great area for clinical and experimental investigation.